guys, so let's go ahead and get started with these exercises, and I'm actually going to go backwards. I'm going to go into position 3, and then we're going to talk about position 2, and then we're going to talk about position 1, because I believe it's mainly the tightness and lack of mobility in your hips from us sitting too much versus a weak lower back that's causing your pain. However, when many of you start in this position, you're probably not going to feel very much. So position number 1, 2, and 3 and the bonus are all time stamped in the description below, so please move free forward through this exercise, through this video as needed. However, starting in position 1, I'm going to explain a little bit in the theory of what I believe is going on. So let's take a break for a second and look at the sacrum here. And then if you look at the sacrum, in the pelvis if you will see how the spine comes out of it, kind of like a tree and roots. Now imagine that these butt muscles that we're looking at right now are holding the sacrum firm. Well, if the sacrum can't move, how is the lower spine supposed to move? It's kind of like uprooting a tree, but yet the roots are in the ground. So I believe from us sitting too much, from a sedentary lifestyle, from learning out of school, from sitting in a car, from working at the office, these muscles in our butt get very tight and tacked down, and they lose their hydration, if you will, and their mobility. So then when we stand up, our sacrum and our spine doesn't move like it's supposed to. Therefore, instead of being like a car that runs out of gas and not moving forward anymore, our body will always find a way. Therefore, we have lower back pain. Now, does that mean that your lower back pain is not coming from your lower back at all? No, not necessarily, and I will get into that in the extra bonus section also. However, what we want to look at is position number 1, and what you can do here is you can just roll. You can even throw your leg up if you want. That's not a problem. But what we're searching for is a little bit of like a flip. So when I'm here and I can feel this dunk, 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 if that is painful, then I want to relax, I want to breathe, and I want to stay in this position. Now you notice that in this position, my left leg is my movement leg and my right leg is turned out and bent a little bit. That is because we want the right leg, the leg that we're working, to be as relaxed as possible. I call this the dead leg position, because if I was trying to massage your quad or something and you just contracted it, it would be a little bit counterintuitive. So here, what I want you to do is make sure that the area we're working on is relaxed as possible. And if you don't feel anything in position number 1, I always say pat yourself on the back and move into position number 2. Position number 2 is right here. And so now what we have done is we've moved a little bit more to the lateral side of our hip. Now this is quite interesting because now we're starting to get into the gluteus medius and minimus. And I always say that the people that I believe that do this exercise and have a lot of success eliminating their lower back pain, most likely they were the people where 70% of their pain was coming from here. However, I believe most people's pain is coming from the tightness in the medius and the minimus, which is position number 2, and very soon in position number 3, where we start going more towards the front of the hip and the TFL, I believe a massive majority comes from there also. Now, the problem is you might recognize sometimes that this is a little bit too painful. So you don't know what to do because maybe you need a new foam roller. Maybe you need to, I don't know, just muscle through it. No. It's the simple law of physics. Whatever this foam roll pushes into, i.e. the ground, it's going to push with equal force back into me. I don't want to go down to physics lessons here, but that just means I need to make the surface of the ground softer. So I literally have some clients start in their bed because the mattress is going to be the softest area they can find. If not, set an extra mat down, find an extra carpet, because it's very important that we allow this leg to stay as relaxed as possible. The minute we start tightening it, we're going to start blocking the actual muscles or closing the doors to exactly where we want to work. So the tip here is you can keep in this case, my left hand on the ground, because this is also a very nice stretch. But if this is too much for you, you can set your hand on your knee, but make sure you don't rotate your hips at the same time, because you're going to move yourself out of the exact muscle that we want to work on. This is great because it also will teach you better awareness of your hips, your body, and your movement. Again, you're going to most likely find a flip where it's like dunk, dunk, dunk. When you feel that, if it's painful, breathe through it, try to relax, move through it, and then when you've stayed in this position for about 2 to 3 minutes, then you can move into position number 3, which now will be completely on its side. So you can imagine that position number 1 is kind of like you're rolling over your wallet. Position number 2 is you're getting the tip corner of that pocket holding your wallet, or the back end, if you will, of your front pocket. And then now the third one is if you're kind of now at the front of your pocket from your pants, if that makes sense. What you will notice here is sometimes the coordination on this one is a little bit harder. You can keep your leg behind or in front. Both is totally okay. I'm going to move myself back in the camera here. And what I want to do now is keep, again, this leg as relaxed as possible. If I lift it up like that, I am closing the door to the area that I want to work. Now, you might recognize there's some pretty sensitive tissue in here. So if you need, grab a softer foam roll or work on a softer carpet. The tip I can give is it's very important to make sure you always start in position number 1, number 2, and number 3, because not only will that allow you to find the area that you're trying to work, but the foam roller or the ball, which I'm going to go into in the extra tip here, is going to then be able to take more fascia with it, get deeper in the muscle, and that means the deeper in the muscle we get, the better result that we can get. So if you go in position number 1 and you feel nothing, that is totally fine. So you say, okay, you know what? Position number 3 is the most important for me. Fantastic. But that means I want you to start in position number 1, go to number 2, go into number 3, and then start your work. That is crucial because A, it's going to make sure that you're in the right position, and B, you're going to bring that tissue with you. You're going to allow that foam roller to go deeper, and you're really going to get some deeper tissue work in that muscle that's most likely causing that back pain. Because once these muscles start to release and relax, that sacrum can move again. When that sacrum is able to move and that pelvis has that mobility, the spine is able to move itself and not be so tacked down, if you will. Therefore, there's no need for the pain because the movement is better and the tension is now gone, if that makes sense. All right, so the bonus tip, and the reason I have these funny colored pants on, is because now I've got a ball. And what I want to do here now is I want to do the same thing. But the nice thing about a ball is not that I can go in circles, not that I can go in triangles, not that I can spell my name with it, but it's because a ball allows me to move left to right. So if you were to think about like a massage on your quad, for example, the massage therapist or the foam roller would go north to south. But if I'm working on your hip or your shoulder or something where I want to do cross friction massage, I need to be able to go left to right. And that's very difficult with a foam roller. The problem is when we move to a ball, many times because the pressure is greater. Let's just say it like that. So from here, what I want to do is start with the same exercise I had with the foam roller. My leg is relaxed. The only difference is now I'm moving left to right, and it's much easier to kind of feel that flip. And then I'm going to go to position number 2. Remember the trick where I spoke about the hand staying on the ground or it moving to your knee. Just make sure that the pelvis and the hips stay in the same position and you find that flip again. And then position number 3, finally, is why I'm here. Again, the leg can go over, it can stay here, and this is where I want to work on the final position. The nice thing about mobility is what you're going to recognize is that you get this automatic gratification 9 times out of 10, meaning you're going to do this exercise, you're going to find out which side is tighter, your left or your right. Make sure to please do both, because the worst thing we want is an imbalance in the body. That's like a tug of war of Team Navy SEALs versus Team Toddlers. That's not a good thing. Find out which side is worse, spend more time on that side, and then what you're going to recognize is when you stand up and you start to move around, you automatically feel looser and better. And that is what is so cool about mobility, because if you're a little bit overweight and you want to get that six-pack and you're trying to diet and do a bunch of sit-ups, you recognize that day 2 and day 3, you look the same, you're just sore and hungry. The nice thing about mobility is 9 times out of 10, you get up and you feel better. If not, that's okay. Sometimes we have this thing called the trampoline effect where you got to go down before you really shoot up. Just stay consistent, drop a comment, send me an email, let me know what's going on, and maybe I can help guide you through exactly why you're not getting the results that you need. Or just stay persistent, keep doing it, persevere, and you will recognize that most likely pretty soon it's going to start getting better. All right, how long should you do this exercise, and should you start with a foam roller or ball? Well, I would suggest starting with a foam roller at first, and then if that feels okay and you happen to have a ball at home, go ahead and use that ball. My favorite is a 12 centimeter because I think that's kind of like the bulldozer side. You don't really need to search for the muscles, and it kind of finds exactly what you need to work on and where you need to work. And then start with one hip, so your right or your left. Start in position number 1. I would search there, and if it's a little bit painful and you can find some spots that need to be released, stay there for about 2 to 3 minutes. Then move to the next position, position number 2, same thing. In position number 3, same actually. And the ones that are more painful, most likely position number 2 and 3, stay there longer. And then switch to the other side, so your opposite leg, and do the same thing. Always search for that little flip, so when that ball of the foam roll moves over something, you can feel that dunk, 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 and you can feel that pain. If it doesn't hurt, stay there about 45 seconds, move on. If you do feel some sensitivity and it feels good to release it, stay there for as long as you want. You can't do it too long. However, you really need to make sure that you start in position number 1, you go to position number 2, and you end in position number 3. Focus on both sides, see how it feels. If you have any questions, like I said before, drop a comment below, send me an email, shoot me whatever, and I'm more than happy to help you walk through these steps and make it more specific for you. So if you like this video, please subscribe to the channel, and also make sure in the link below you check out the free 5-day Unbreakable Body Challenge. I personally believe that the hips and the shoulders are the engines to the body, and the human body is the most sophisticated machine built to date. We just never got the owner's manual. So that is the first step of the 5-day Unbreakable Body Challenge. Join that below, send me a message. I hope to see you in the private software where we can communicate one-to-one, and I can help start teaching you why you should be getting better as you get older and not breaking down.